COVID-19 responsible for 200,000 direct and indirect deaths in some 20 countries, according to a study. Paris. The first wave of the COVID-19 pandemic is responsible for more than 200,000 deaths, both directly and indirectly, in around 20 Western countries, estimates a study published Wednesday. 19 nations in Europe, Australia, and New Zealand recorded a total of around 206,000 more deaths than expected if the COVID-19 pandemic had not occurred between mid-February and the end of May, concludes this mathematical modeling study, published in the journal Nature Medicine. England and Wales as well as Spain appear to be the hardest hit nations, with a 37% to 38% increase in mortality over expected levels in the absence of a pandemic, against an increase of 18% on average over all the countries analyzed. Italy, Scotland and Belgium follow, while France ranks 8th, with a relative increase in deaths of 13%. A group of 10 countries including Australia, New Zealand, Hungary, and Norway were able to prevent a noticeable increase in deaths. The disease caused by the SARS-CoV-2 virus has directly caused more than 1 million deaths worldwide, according to official counts, but it has also resulted in deaths indirectly, due to its social and economic effects and disruption of health systems, drop in income, delayed diagnosis, postponement of operations, decline in physical activity, increase in suicides and intrafamily violence, etc. Similar to lung cancer. Conversely, reduced road traffic or improved air quality during containment may have prevented deaths that would have occurred without the pandemic. Knowing about these indirect effects is necessary to understand the real impact of the pandemic in terms of public health, explain researchers at Imperial College London. This figure, 206,000, is similar to the total number of deaths from lung cancer, and is more than double those linked to diabetes or breast cancer in these countries for an entire year, said in a statement the National Institute for Demographic Studies, INED, associated with the study. The researchers used mortality data since 2010 in the countries studied to establish how many deaths they would normally have expected in the period from mid-February to May 2020, if the COVID-19 pandemic had not had location. They then compared these figures to the number of deaths actually recorded during that period from all causes to infer the excess mortality attributable to COVID-19. The countries chosen for the study are those with populations exceeding 4 million and for which the team of researchers had weekly mortality data, broken down by age group and sex, dating back to at least 2015. Refer patients. According to the authors, the differences between countries reflect variations in population characteristics, policies, response to the pandemic, and the preparedness of public health systems. To minimize the toll of the pandemic, building care pathways to properly orient patients and care for those with chronic illnesses is as important as fighting the transmission of the virus, they argue. The results of this research could help put in place public policies that will limit mortality from future waves of the epidemic, said and. Countries with effective and comprehensive testing and contact tracing campaigns at the local level or those with early and effective containment measures in place have experienced a lower death toll. During the first wave, observes Jonathan Pearson Studdard, co-author of the study, based at the School of Public Health at Imperial College. As we enter the second wave, testing and tracing programs, and support for people who need to self-isolate, represent our most important lever to minimize the impact of the pandemic, he adds.